Everything from turning patients onto their stomachs to advanced drug therapies. Among those, Remdesivir has been considered promising.
Yesterday evening, the president received his third dose of Remdesivir.
It was one of the drugs Donald Trump got when he was hospitalized, but a study still awaiting peer review looked at thousands of patients in 30 countries and found no clear reduction in mortality rates or length of hospital stay for Remdesivir. That contradicts the findings of a study from the drug's maker, Gilead Science. Let's bring in Dr. Srinivas Murthy, who's here in Vancouver and who led the Canadian arm of the trial. And Dr. Murthy, what are the implications now of the use of this drug in Canada?
Yeah, it's a great question. So what we know now is that for all patients who are hospitalized, it doesn't reduce mortality, your need for a ventilator, or your length of stay. There may be a possibility of the less severely ill getting some benefit, and we're still studying that in Canada right now.
So tell me a little bit more about that process. What will be happening among doctors across the country?
Sure. And so for patients who are hospitalized with COVID-19, a research team will approach you and ask you if you want to participate in our clinical trial. And we'll randomly assign you to either receive Remdesivir or not. Given the data that we put out today, it makes sense to get more data to really refine what we know about this drug and whether it's useful or not in the Canadian health system.
You know, it wasn't that long ago the doctors were talking about this drug and talking about, you know, with some optimism, the promise that it had.
Yeah.
I guess that optimism is now gone.
Yeah, it had a ton of promise, and I was very optimistic myself at the beginning of the pandemic, and that's why we studied it in 5,000 patients around the world. Unfortunately, it did not live up to that promise, and we'll move on to the next drug to find something that works and helps reduce mortality for Canadians and people all around the world.
All right, Dr. Murthy, thank you very much.
Have a good day.